So Dr. Chan, thank you for being here with the San Francisco Bay Area Moms. We've covered quite a bit since COVID-19 hit with another pediatrician talking more about some of the physical aspects of the illness itself and the testing and all sorts of wearing masks and other things that parents have been concerned about. But what we haven't really addressed is what we're going to talk about today, which is the effect on a child's vision and what, in general, the trends for children's vision, but also in light of COVID-19 and the coronavirus. So one thing I understand is that approximately 20 million children in the United States suffer from something called myopia. So can you tell us exactly a little bit more about what that is?
So Ali, first of all, I thank Ali and Tracy for inviting me here. And so myopia, as we know, is commonly known as nearsightedness or short-sightedness. And it's the most common vision issue among children and young adults in the world right now, and especially in the United States and in Asian countries, and it's only getting worse. And like you said, approximately 20 million kids in the United States are nearsighted, and that's about 1 in every 3 or so are suffering from some type of nearsightedness. And by the study show that by 2050, then half of the world population would be nearsighted. So that is pretty a pretty big number, I think. Mm-hmm. And just in the San Francisco Bay Area alone, right now we have, in 2020, right now we have 176,667 number of kids who are nearsighted. So as we know, nearsightedness causes blurred vision, and it affects the school learning. Right now it's all virtual, but when they're at school, they won't be able to see the board and see out there doing sports. So it affects their ability to function academically and also with doing sports also. And this number would only grow in 10 years in 2030. The study showed that it will grow to about 220,000 and 557 kids will be nearsighted. So that's about 26-27% increase in 10 years. Those are pretty big numbers.
Yeah.
So,
what are some of the reasons for those growth rates?
So the two most common reason is genetics and environmental. So in the past, we talk about half genetics. I tell my patients, the parents, and why are my kids nearsighted? So, well, half of it is genetics and half of it is environmental. And now we think more of it is environmental too, because as you know, some of the parents will come in and say, how come both me and my husband, me and my spouse are not nearsighted? Why are my kids so nearsighted? So we think that studies show that there is a lot of environmental factor involved. And with this COVID shelter in place, the kids, even my kids, are indoors all day doing Zoom meetings, Google meetings, Google Classrooms. So they don't get to go out as much. So the shift in the environments that the children are growing up mainly, and the lack of outdoor activities in these children nowadays is the largest piece of evidence that the researchers are showing causing this nearsighted, we'll call it nearsighted bloom.
Okay.
And so the COVID has forced a lot of kids indoors, and there's no doubt that virtual learning has a big impact on the increased time with the digital device and the near work. And the lack of outdoor activity also is the main cause.
What, well, you mentioned a concern in academics and in even how it might affect a child in sports. Are there other concerns? What other things should parents be concerned about with this?
Well, with nearsightedness could have a lifetime impact on the children's vision and the children's eye health. Studies show that if the kids' nearsightedness increase, if left untreated, myopic children would have a significant increased risk for retinal detachment, cataracts, and other serious health complications later in life.
So can it be prevented? I mean, is there something we can do now to help prevent it from happening?
Yes, there are different ways in our office. A lot of the offices also, there are different ways to help manage the nearsightedness. So we in our office, we are 2 offices in San Francisco. We use the treehouse eyes method to help manage the children's nearsightedness by either having customized soft contact lenses for them to use, specialized eye drops also to help control the prescription or manage the prescription, and then also customized customized rigid gas perm lenses to help with that too.
What should parents look for in their children if they have concerns? Are there certain behaviors or symptoms that might pop up that might raise some red flags for parents?
So if the kids, if the parents see that the kids are squinting, they have to sit closer to the TV, or they're underperforming in the schoolwork, or even at sports, they're not catching the ball properly that they were able to catch in the past. So those are the little signs that the parents should look for. Or sometimes the kids even rub the eyes to try to see clearly. And there are times that the parents didn't realize that the kids couldn't see, and they come in for eye exam, and they said, when should I bring my kids over for eye exam? And I usually tell them by the American Optometric Association, the recommendation is the first eye exams should be about 3 to 6 months old, and then 3 years, 5 years, and then every year after they get to school age. And so they would bring the kids over, and then they realized they couldn't see, and the parents would be so surprised. They said, "What? This big letter you couldn't see?" And so we catch also a lot of issues when they bring the kids in, even if the parents realize, "Oh, I don't think my daughter and my son has any problems," but it doesn't hurt to bring them in to the eye doctor to get the eyes checked, because for vision screenings or through the school or to the pediatrician's office, about 75% of those screenings could miss a potential eye problem. So not just myopia, could be lazy eye, farsightedness, eye turns, little eye turns that are not easily seen, or one eye is not seeing as well that the parents won't know, or sometimes they cheat a little bit when they do the screening. So those can all happen, but in the eye exam, we can definitely catch those.
That's great. And what is the exam like? When a child comes to your office, what is the environment like, and what can they expect?
So when it depends, we see a lot of kids in our offices, so we cater our exams to how old the kids are and how they are when they come in. So for example, a 3-year-old who comes in versus a 10-year-old or 15-year-old, we actually treat them a little differently. So parents always ask me, well, my daughter's only 3 years old, but I'm concerned because both my spouse and I have high prescription or have eye problems. So I tell them just as long as they can sit still, the doctors can check and see what type of prescription they have. So we don't even need, a lot of the parents say, well, they can't even see the letters. We actually have images, we have pictures for the kids. They could look at the pictures like a bird or a birthday cake. The 3-year-olds would know, and the different sizes. And even if sometimes they're shy, they come in and we would, there's a instrument that we just look into the eyes with it's called retinoscope. We actually could tell what prescription they have without them telling us what letters they're seeing.
Okay.
So we could check that for big changes in the prescription. If they have a pretty high prescription, we realize, oh, this might cause problems in the learning or in the visual development down the road. And then the second thing is also important other than vision and prescription is the health of the eyes. Even though young kids, the chance of having eye disease is not as high, but that's still possible. So we also check eye health inside, and a lot of times we either dilate the eyes, dilation with the eye drops, or we have a camera, like a digital retinal camera that takes a picture of the retina so that we can see what the back of the eyes look like and make sure they're healthy. So the eye health and the vision is actually very important. So going back to your original question, when the kid comes in, what should they expect? As you can see, my background has leaves. It looks like a treehouse light. It's modeled after the program that we model after called Treehouse Eyes Vision System. That we work together to help kids with nearsightedness and help manage the nearsightedness too, and the kids' vision overall. So when the kids come in on a normal exam room, it's usually white background, and they come in and they see all the instruments and the big equipments and what we have, and they're already nervous, and they get even more nervous. But since COVID, we actually remodel our room to make it look like a treehouse inside the exam room. And parents actually like it too. Adults, they say, hey, I like this. But kids, when they come in, instead of looking at the equipment, they actually look at the trees and they get distracted. So that type of anxiety that they have is pretty much non-existent, or a lot of them will go away, and then we're able to perform the exam a little bit more. So the exam consists of, usually for a younger kid, a 3-year-old, 4-year-old, consists of checking the vision, checking see if they have a high prescription, if they have any eye turns, the color vision, eye alignment, and then the eye health. So those actually are very important. And for an older kid, a 5-year-old or 6 years old, they usually know the letters, so we would have them read the letters a little bit more. And but we have our exams that you try to make it kid friendly. We try not to touch the kids' eyes as much as possible, and when we do, we usually let the kids know what we are planning to do for them. I think with kids, the unknown is what's scaring them. So we usually, our doctors would spend the time and explain to them, hey, this is what we're gonna do. So that really helps calm the anxiety. And parents also could have an expectation of what they come in and what a lot of the eye exams would be like.
That's excellent. Yay. Thank you. Thank you so much. Is there anything else that you would want to add or would want parents to know about eye health for their children?
So as we talked about earlier, our mission is to try to fight nearsightedness or try to manage nearsightedness. The best prevention, a lot of times parents come in, it's when the kid's already nearsighted, but the best prevention is before the myopia starts. So numerous studies show that being outdoors would help with the eyeball from getting longer. So at least about 2 to 3 hours a day, if possible. I know sometimes it's not, but at least 2 to 3 hours a day, that would help send a feedback to the brain to help prevent the eyeball from getting longer. So the earlier the prevention, the better. So if the kids are nearsighted already if they're 3 years old versus 5 years old versus 10 versus 15, there's a big difference because as they become nearsighted, the eyeball also, as they grow, they get longer too. We want to prevent the eyeball from getting longer. So once they become nearsighted, they should find a doctor who's certified and who's experienced at treating this myopia so that they will not get worse. And then being outdoors definitely would help. That's what I tell all my patients, my parents, once I know they're pregnant or they have little young ones, I tell them, you know, we do a lot of nearsighted management, but my goal is not to treat your daughter, your son with myopia if possible. And the outdoors with the kids, not indoors. There are a lot of studies that show that kids that outdoors definitely would help. They don't become as nearsighted, and the nearsightedness is definitely not as high.
Great. Thank you. Thank you so much.